Dr. Joseph Canu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Canu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. And now your host, Dr. Joe.
Well, hello, Metro Detroit. This is Dr. Joseph Canu of Rochester Chiropractic Clinic.
And this is Dr. Jeff Haddad of Rochester Advanced Dentistry.
Yes, our show, Simple Truths for Healthy Living, where our goal is to be in the perfect will of the Almighty God, the Father, the Son, Jesus, and the Holy Spirit, to be teachers, servants, and examples of simple truths that prolong and enrich our lives emotionally, spiritually, and physically. So, Jeff, what do you have in store for us this episode?
You're just so anxious to get to this, aren't you?
Come on.
Well, it's funny that you mentioned education, and I don't know about you, Dr. Joe, but lately I have had so many new patients that are coming to me really to be educated. I've always believed that nobody really needs to do some of the things that dentistry provides. And I say that tongue-in-cheek a little bit. Obviously, if you're in pain, you've got some serious issues, you really should do things, okay? But I have, made the joke in the past that you don't need teeth to live. But
you have said that.
Life is better with teeth, okay? In addition to the fact that, as we've talked about, the health of the mouth is connected to the rest of your body, and for us not to know what's happening from a disease standpoint or from a breaking down of a bite standpoint or anything that's causing other issues, not only in the mouth, but headaches, jaw pain. We've talked about the connection between some of the diseases of the mouth and heart disease. I always feel that I need to educate my patients to give them the information that they need to make the right decisions for themselves, okay? And I pretty much end any conference or consultation I have with this. I just want you to make the right decision for yourself. You're not going to hurt my feelings if you don't, do any or all of this work, but as long as you have the right information, then I feel like I've done my job.
Sure.
And so what I'd like
you really want to educate your patient.
If I educate my patients properly, they are going to make the right decisions because I'm going to tell them the risks of maybe waiting on something or the risks of not doing anything and, of course, the positives of addressing an issue, And, what I'd like to do, and I've kind of been waiting for this for a while, is we've kind of alluded to the fact that you and I we've been spending some time in the dental chair over the last couple months. Is that fair?
Oh, boy, yeah.
And so I always have said that, if you're going to exploit anybody, you want to exploit your friends, right? So I would like to share your experience with our listeners. And again, I joke about the exploiting. It really is educational. I mean, for our listeners to listen to your experience in the chair, because really what we did for you, and we're going to get to that, I feel like I'm teasing people a little bit, but what we did for you honestly encompasses so many different aspects of dentistry that it's going to educate the masses. Even if they didn't have the extensive treatment that we did for you, they're going to understand why we address certain things and why it's important to take care of certain things sooner rather than later. And so really today, and we'll see, my guess is this may be a couple shows. It may even be a B2 continued, if you will. But I think that we are going to really take care of a lot of questions in people's minds because using you as an example and hearing what you've gone through and some of your quote-unquote aha moments are really going to inspire some people to maybe get some of the dentistry that they've maybe been postponing for a while.
Okay.
So it's going to be all about you, Dr. Joe.
We need to, all right. Well, let's start with a scripture, Jeff. we're going to go to Exodus, way back. Exodus 15, verse 26. He said, if you listen carefully to the voice of the Lord your God and do what is right in his eyes, if you pay attention to his commands and keep all of his decrees, then he will bring you out of disease and into health and help heal you. How about that?
Did you plan that? I feel like you just,
No,
it's amazing. You just open up the Bible every once in a while and find the right verses. It's impressive.
That is the Holy Spirit, isn't it? So that is part of what you were talking about. You empower your patients to make the right decision. Correct. But we need to make an educated decision, right?
Yes, we do. And you can't do that without the facts. You know, I mean, obviously, there's a lot of opinion in what I do, too. I'm going to give you my opinion. But what I'd like to do is give people objective data. You know, I want people to know what is fact, what I'm seeing, not only what I'm seeing, but I show patients what I'm seeing with photos. I really can get across to people.
Do you call that a Dentacam, Jeff, or the camera, or is it just...
Well, how about this? We do use two things. There's two things that we utilize. One's really, I would call it an intraoral camera, okay? And that's really for, you know, let's say you got a broken tooth. I'm going to take a picture of that one tooth. Now, if you remember what we did for you when we're talking about lots of different areas of the mouth, I actually use just a very high-end actual extraoral camera, a very nice camera that gives me the proper dimensions. I have a certain series of shots that I've been taught to take through the many classes that I've been through that really give people not only a view of their smile from the front, but also from the sides. Because a lot of people don't think about that, and that's what we call the party smile, Dr. Joe. All right, we're looking at the front, and you think, oh, there's my front 4 teeth, maybe the front 6 teeth. Do you know how many teeth the majority of the people in the world show when they smile? 8 to 10.
8 to 10.
8 to 10. Most 10, to be honest.
Including upper and lower.
No, that's just uppers.
Just
upper
uppers.
10 teeth. Because when we smile, and believe me, people are listening right now saying, oh, no, I only show 6. I promise you, the only way you can show 6 is if you're pursing your lips, okay? No human being shows less than 8 teeth for the most part unless they are really trying to hide their smile, which we do see a lot of.
Right.
But so we take these shots not to bring more attention to other teeth, it's to show them what other people see. Because it's important. I mean, if there's something that's going on and you can't see it and it's not hurting you, is it going to be an urgency for you? Probably not, right? So I use these photos to really show people that this is a priority. If I show a big picture of a broken down amalgam that has, you know, bacteria that's present and it's corroding in the tooth, I put that up on a computer screen, they're going to say, wow, I can't believe that's in my mouth. I mean, it's the very back upper tooth. Do you think they care about it? Yeah. No, it's not hurting them, but obviously they're looking at it saying, that is not healthy. That is not good. Yes. So me using photography is very important. And if you remember, the first time that you and I really sat down with you, I did utilize photography.
Sure.
Now, why don't we start off from almost a chronological order here of, you know, you came to me. I mean, obviously, we were doing the show together.
I really liked the visual, to know what's in my mouth and to see it.
Well, and you know what's helpful, too? I mean, you knew me personally, so I have to assume you trust my judgment, you trust me as a person, which I do appreciate. But when I meet somebody from the very beginning, yes, I hope my reputation speaks for itself. However, I want to earn somebody's trust, and they really don't know me. Well, if they're looking at a photo, it's not my opinion. It's objective data, you know. And I let my patients be part of the process. It's important for me. I don't ever want to dictate treatment to anybody. I want them to be part of the process. I want them to guide me to what their goals are. Now, if there's something that they're not seeing or don't realize how important it is for us to get to, I'm going to steer them that way too, but I'm going to make them part of the process. And correct me if I'm wrong, because I don't want to put any words in your mouth, but did I do that with you? And more importantly, you know, why don't you let the listeners know what some of your concerns were at the very beginning of us just talking?
Well, you know, my concern personally with my condition was I noticed my bite changing and that my teeth were shrinking, you know, the height
things are getting shorter.
The height was getting shorter, and I knew that was going to start putting more pressure and strain on my TMJ joint,
Right.
cause uneven wear, and that might lead to sleep apnea
Right.
and health issues in the future.
Right.
So I knew I wanted to do something before it got out of hand.
Now, did you have any
Right.
idea what some solutions were? I mean, did you really have? I mean, I'm not sure where you're.
Well, I tell you what I would have loved to have had done is, I mean, stem cell and grow my own teeth back.
Well,
you know,
hopefully they'll come to us
I mean,
someday.
how far out are we? How far are we out with that?
Unfortunately, you hear some good things, but I don't think it's going to be happening. I don't think it will be growing into your teeth back in your lifetime.
No.
But who knows?
Who knows?
We don't have to now. We've rebuilt you. We don't need to, right? But no, and those are all great concerns.
Right.
If you remember, we also had a little bit of a decay problem, right? We had some older dental work that you've kind of had over the years, which is very common.
And it was really breaking down.
Right.
Yeah, so that was a huge concern because the older dental work, I knew that there was pocketing, maybe bacteria starting to grow around the edges.
Right.
I didn't want to be growing bacteria factory in my teeth
that's
leaching into my body.
You got it.
Because, we try with chiropractic to keep your nerve flow going, eat all this healthy food, but then if my fillings and the teeth are corroded
right.
and compromised, I know I'm going to be constantly bombarding my body with a lot of bacteria and toxin.
You got it. Well, in addition to the fact that when you have, say, a cavity on a tooth, it doesn't just sit there. It progresses. Then we start talking about more aggressive and invasive procedures need to happen. You start having nerve problems and you need a root canal. Or, God forbid, we don't get to it in time and literally the tooth is eaten away by the decay in the cavity and you actually lose a tooth. And these are the things that luckily we got to you in time. You saw some issues happening and that's a great thing. I mean, I give you a lot of credit for that. A lot of patients either don't realize it or, to be honest, are almost in denial a little bit, hoping, oh, you know what, it's not hurting me. I'm sure it's fine. Well, when it's hurting you, it's too late, okay? Please, for those of you listening, I hope that today and, all of our shows really inspire you to, at the very least, get in for your regular checkups, there could be things happening in your mouth that you have no idea what's happening. A cavity doesn't hurt until it's too late. Okay, when a cavity's hurting, that means the nerve of the tooth is involved, and now you have two choices, only two. It's either a root canal or extracting the tooth. You can't put a filling in anymore because now the live portion, the nerve, is affected. And it breaks my heart when patients come in. I tell them this stuff like, they're kicking themselves because they waited too long. Because I think in the back of their head they knew that there were some issues possibly, but people get a little fearful, and they don't, they're hoping it just goes away. Well, I'm here to tell you that these issues don't go away. They don't fix themselves. Unfortunately, they end up being more time, more money involved, and more invasive. And that's what we want to avoid. We want to be conservative. So I appreciate what you're saying, and I think that, when we first took a look at you, I did use a lot of photos to bring things to your attention. You saw some spots that you blatantly said, is that a cavity? I said, yes, it is. Yeah. And that concerned you.
It did. And seeing the pictures really makes it look, now I realize it was worse than I thought.
Right.
The problem was worse than I thought.
Well, and so what we'll do, and what I'd like to do, if it's okay with you, and we've talked about this. Well, we keep talking about photos, okay? I would like to, in future shows.
You're not going to put the photos of my teeth on our website.
I would really like to. I would like to, if that's okay. I think it would be very well. How about this? Not only is it going to let people know how photography can bring some certain things to attention.
So you really are thinking of doing this?
I'm planning on it. you mean you didn't get that memo?
Uh-oh.
I would like. I think it would be very educational.
You better take me golfing or something if we're going to do this. I want something. No.
We'll work that out. You'll get royalties on those photos. But I think it would be very good for people to see. Because what you said was very accurate. I mean, Dr. Joe was concerned about his bite. He was concerned about the health of his teeth. And so what we found was when we did our measurements, and you lost almost 30% of some of your teeth from a height standpoint. That is significant. Yeah. Okay, and so what does that do? Well, exactly what Dr. Joe said. Not only do things not look as healthy as they should. I mean, obviously we want to feel and look healthy, but more importantly, once you get past the enamel portion of your teeth, which you were in several of your teeth, now you're into the dentin, which is the next level of the tooth that is much more susceptible to decay.
Right.
Dr. Joe.
Plus it's very soft.
Very soft,
saying, right?
Exactly.
So it's going to really wear. If I wore through the dentin, the enamel, then the dentin's going to. That's where I lost the height.
Correct.
Right?
And that actually wears 7 to 15 times faster than enamel. Now, not only does it wear faster, but Dr. Joe, I'm going to give you a huge compliment, and this is a fact. You take very good care of your teeth. Better than most, to be honest.
How can you tell that, Jeff?
Because your gum tissue is in such good health. When we look at, we can tell. When people go to the dentist and they're like, oh, I haven't flossed in 6 months. I'm going to really cram tonight. Believe me, we know. So please don't waste your time and don't bloody up your gums trying to saw through things. No, I can tell. But we said you still had cavities. Why did you have cavities? Because you had a lot of things going against you. You were into the next level of tooth, which is softer than the outer portion, which makes you more prone to decay and cavities. Okay. You also had some old dental work, and this is classic. Older dental work, just because it's not falling out of your mouth or hurting you, does not mean that it's not failing. Dental work does not last forever. I wish it did. I mean, honestly,
I like your analogy like a car.
Like a car.
A car is going to wear out.
It is. I mean, nobody plans on driving the same car in 20, 30 years. Maybe you are, but the odds are against you. I mean, everything breaks down.
Right.
Or you're going to need a lot of maintenance. Is that fair to say?
Sure.
And so when people say, oh, is this crown going to last forever? Nothing lasts forever here, all right? Unless we're making out of diamond, which we don't do very often, actually ever. And so you, unfortunately, had a lot of older fillings and restorations that were actually catching food, catching plaque.
So they're food traps.
Food traps, exactly. I mean, you are doing your best, and you're flossing, and you're doing everything you should do.
Because you could tell by my gums
your gum tissue, well, and also on the teeth, and we can tell when there's buildup of tartar on the teeth and things like that of what level of oral hygiene you have. And so when we have somebody like yourself who is taking care of themselves,
and they're still having a problem,
correct? We need to intervene. Okay, so what do we do with a person like yourself who has worn down 30% of their tooth structure in many areas of their mouth, has many old fillings that were breaking down, and the big picture, a bite that is not comfortable for you anymore. I mean, you knew you weren't feeling comfortable. You said you couldn't even chew food the way you wanted to, correct?
That was another thing that was bothering me, Jeff, is that I was having to concentrate as I was masticating, chewing.
Yeah, I
had to really concentrate. And I still felt like I wasn't breaking down the food well enough. And as we all know, digestion starts in the mouth, right? The salivary, you start saliva, it has enzymes that break down your food. Chewing is so important. Chew your food, chew it again. But I was chewing, and it still seemed like I'm having to think this too much.
You should. It's like the old adage of walking and chewing gum at the same time, right?
Yeah.
I mean, you should be able to do that. You shouldn't ever have to think about eating. All right. I mean, that's a really great point. I mean, people who say, "Oh, yeah, I don't chew over there because it hurts." Well, there's a reason it hurts.
Yeah.
Let's figure that out. And the fact that you knew there was an issue, you knew you weren't processing the food and being an effective chewer. That's a pointing to a bigger problem. Okay.
Sure.
So we've got somebody, Dr. Joe, and I see these patients all the time. In fact, before I even go on, if you'd like to get an idea of the type of overall dentistry that we're talking about, you can go to our website at rochesteradvanceddentistry.com, or you can call our office at 248-656-2020. I have so many before and after pictures of patients whose bites really were broken down and we had to rebuild. It falls under this category that we call neuromuscular dentistry. It's where we're getting the bite properly supported based on the facial muscles and the TMJ joints, which is exactly what Dr. Joe is asking for, right? We have before and afters and video and a lot of things that educate, okay? So for you, if you need the visual while we're talking. But for someone like yourself, where do we start? Where do we begin? If you've lost your bite, which is what happened, how do we rebuild you? Do we guess? I mean, do you want me guessing where your bite is?
No way.
No, it's scary, right?
It is scary. The more you know, the more leery you are about going forward.
No question about it. I mean, that's a big undertaking, right, to start rebuilding your mouth.
But, Jeff, when you had that K7 jaw tracker on me, before, that gave me so much confidence.
Oh, look at you getting ahead of yourself here. I love it.
Okay?
No, that's fine. You're right.
No, but that did. Before we went forward with this whole thing, I mean, I knew I needed to get these old fillings out.
Right.
And needed to, get the height of my teeth back for the sake of my jaw joint.
Right.
But I had a lot of confidence with this K7 jaw tracker.
Well, let's talk about that. That's actually what I was kind of steering you down that path. Like, where do we start?
Okay.
Well, there's a lot of dentists that they actually do guess. And I'm not knocking that. That's okay. Yeah. I don't feel comfortable guessing. I've never have. We talked about objective data. I want objective data. So what Dr. Joe's referring to is I actually have a computer and a muscle relaxer called a TENS machine, and with two, I can actually hook up a patient, find out exactly where their muscles are the most comfortable and where their bite used to be. I mean, 20 years ago, your bite was fine, right?
Correct.
I'm guessing that, but
right.
How do I get back to that bite? Well, I use Dr. Joe's or any patient I'm working on's actual body. It will show me in real time where the jaw should be in relation to the upper jaw. We make a registration of that based on the muscles of your face. I can see exactly where I like to call it the sweet spot is, okay? Right where your muscles are the most comfortable. If your muscles are comfortable, that's where your bite should be. Now, where we found your bite, okay, and we haven't even talked about this, but I love this because this was a very, what I call an aha moment for Dr. Joe, because at this moment, he wasn't planning on doing any of this dentistry. We were just kind of talking. I was just educating. I really was, right? And so we sat down, we hooked him up to the machine, we relaxed his muscles, and I can see all the data on the screen. And I guide him to a position that I can see his body is comfortable. Now, I'm not looking at his body. I'm looking at his muscle readings.
So basically, for the listeners, there was electrodes, just like little sticky pads, on my temporal muscle, on my jaw, different muscles.
Correct. Four main facial groups, correct?
Okay, so you were actually, and they were all hooked up to this machine.
Yep.
So it was an EMG machine.
Correct.
Electromyo, which means muscle, electromyogram,
you got it.
Which we use in our office. The spinal muscles. If one is contracted more than another, it tells us there's a problem.
Right.
So that's what you were looking at.
This was telling us which muscles were in tension, and when Dr. Joe brought his teeth together in his normal bite, muscles went through the roof. Now, luckily, you weren't experiencing any headaches or jaw pain or anything like that at that moment.
Right.
But if we fast forward 5-10 years, all that tension built up, you're eventually going to get pushed over into a pain spiral. And luckily, we got to you before then. But yeah, this is a machine that measures the muscles and then shows me where in that jaw relationship it should be, where it is comfortable. And if you'll remember, I guided him to a position. We put a little putty in there to hold it. And I said, and before I could even say anything, what did you say to me?
Well, I was really amazed, Jeff, that you were not even looking at me. You were looking at the computer screen, seeing what the muscles were doing, and you were telling me, move your jaw forward, move your jaw forward. And then we got to a point where innately, instinctively, intuitively, I knew this is the bite I should be in.
Yep.
And you knew that without me telling you that.
No. Yeah, I mean, you told me after the fact, and you're like, Jeff, the whole time, I remember this.
Yeah. Because I remember you said, okay, now keep it there, hold it there, and I'm thinking to myself, no, it needs to go a little more. I wasn't saying that. I was thinking that. And then finally you said, okay, move a little bit forward more, and I thought, that's it.
Right.
And you said, that's it. That's the spot.
Like I was reading your mind.
You were inside my head.
I was reading your body.
Yeah.
And this is the stuff that
was like what we call objective findings.
Yeah,
subject is what the subject tells you, right?
Right.
So objective means it's like taking your blood pressure. It is what it is, or an X-ray. It is what it is.
Right.
This K7 jaw tracker, it is what it is. There's no opinion.
Exactly.
I feel this way. No, it is, you look at an x-ray, you see a broken arm.
Right.
That's an objective finding.
You got it.
And you objectively discovered exactly where my bite should be.
You got it.
And then I just had a lot of confidence. At that point, Jeff, your value went up, up, up.
All right. I like it.
I like it. Point,
well, it's funny, just for those of you who are listening to what we're talking about, this machine I use for patients like Dr. Joe who have lost their bite. This is also what I use to treat people with migraines, overall muscle tension headaches, jaw pain, anybody that kind of falls under that umbrella of TMJ pain, which is a temporomandibular joint problem. And I mean, we're talking vertigo or dizziness, ear ringing, ear congestion, neck pain, migraines. All this could be related to a improper bite, okay? And this technology is what allows me to do what I do. And believe me, Joe, you're not the only other person in my career that I've had to kind of quote-unquote prove my value. And that's okay.
Right.
This instrumentation, and luckily my experience with it, allows me to do that. And so I'm glad I proved it to you, and I'm glad I'm able to help others, and this helps me do it. I don't like to guess. I want to have the facts.
Well, you know what, Jeff? I know, like we do the surface EMG at our office and do some tests with machines, but a lot of times it's only as good as the practitioner using it. Right? There's only a few people, and that's what gave me a lot of confidence. Not only was this a cool machine that you use, but that you knew how to use it. You must have gone through some extensive training and didn't just, this looks cool, get it in the office, hook somebody up, and not really understand what you're looking at.
Right. We've been using this instrumentation honestly longer than anybody really in the area. There's not even that many people in Michigan that have this instrumentation, but it's a big focus in our practice. And so,
if I was a dentist, I would have this, and I would go through all the training.
It's a big commitment. It is. It's taken a long time, but it's worth it. I'm able to help people in pain. I'm able to help people like you who have to almost start from scratch and find where their bite is and rebuild it. And so, what I'd like to do, I thought. I knew this was going to happen. We kind of run out of time. We
are out of time.
But this was perfect.
I'm giving Jeff the hook sign.
It's okay. It's perfect because I knew that this was going to be in depth. I wanted to hear your opinion and your feedback. And next show, if that's okay, what I'd like to do is continue on with this because we've pretty much we found your bite. Now what are we going to do with it? Okay. That's what the next show is going to be all about.
That's the next show, so stay tuned next week for that.
Looking forward to continuing.
We've got some things to tell you. So thank you for donating your time, Dr. Jeff.
My pleasure.
If you want to contact Dr. Jeff, Rochester Advanced Dentistry, 248-656-2020. You can go to our website, Simple Truths for Healthy Living, and listen to all these shows, or to Jeff, your website,
correct,
which is
RochesterAdvancedDentistry.com.
And it is advanced. I can endorse that.
I appreciate that.
And so until we meet again, remember, in all that you do, eat or drink, do all things to the glory of God. See you next week, Jeff.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Canu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Canu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Canu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.